Good evening, everyone, and a very warm welcome to the first Cambridge Conversation of 2025, Unlocking Brighter Futures, Child and Adolescent Mental Health in the Digital Age. My name is Professor Paul Wilkinson. I'm Clinical Dean of the University of Cambridge School of Medicine, and as other bits of my job, I'm Professor of Youth Mental Health here, and also a consultant child and adolescent psychiatrist. And it's my pleasure to chair this evening's discussion. We live in an increasingly digital world, and the landscape of childhood and adolescence is constantly changing. While digital technologies offer incredible opportunities, they do also present new challenges to us and lots of complexities when we think about how they affect the emotional and behavioural development of our young people. Tonight, we gather to explore how we can collectively support children and young people in this digital existence, drawing on some of the very latest research coming out of Cambridge. Now, this Cambridge conversation isn't just about identifying problems, it's also about seeking solutions. We'll be tackling some critical questions. How do we truly unlock brighter futures and improve the mental and physical health of children and adolescents? Our esteemed panel will delve into the essential shift in the research approach, from isolated treatments to recognition of the profound connection between mind and body. They will also explore some innovative solutions, many of which are fundamental to the Cambridge Children's Hospital, which is about to start being built. So, without further ado, I'd like to introduce our two esteemed panellists joining me tonight. First, we have Professor Tamsin Ford. Professor Ford is a Professor of Child and Adolescent Psychiatry and Head of the Department of Psychiatry here at Cambridge. As an internationally renowned child psychiatric epidemiologist, Tamsin's work focuses on the organisation, delivery and effectiveness of services interventions for young people's mental health. Her research is inherently translational, directly informing policy and practice. And importantly, Tamsin's also one of my clinical colleagues as another consultant child and adolescent psychiatrist working in the paediatric liaison service, which helps children and young people who are getting treatment for their physical health from the paediatricians, but we work with them to help assess and treat their mental health. Next, we have Dr. Amy Orben. Dr. Orben is a programme leader at the MRC Cognition and Brain Sciences Unit here in Cambridge and a fellow at St John's College. She is one of the world leaders in how digital technologies specifically affect adolescent psychological well-being and mental health. Her work has significantly informed advice given by national and international experts, including the UK Chief Medical Officers, the US Surgeon General, and many other governments around the world. And she's been recognised with numerous prestigious awards for her impactful contributions. This evening is an opportunity to hear from leading experts, gain insights into pioneering research happening here in Cambridge, and engage in a live Q&A. And I'd like to thank you as an audience for sending so many questions in advance. Apparently it's a record for these events, so thank you for that. So I'm going to keep an eye on the chat and look for new questions coming in, but I've got a list of questions that people have sent me already that I'm going to use as a basis for tonight's discussion. So first off, we're going to have a think about physical and mental health and how they're linked. And one thing commonly said, including by me, to be honest, is that to get better overall health outcomes for young people, we must make an important shift. We must move from treating isolated conditions to understanding the complex interplay between mental and physical health. But why do we say that? And how do we do that in practice?
Well, we say it because it's very necessary. You know, we see whole children in the clinic. And indeed, I think it's something that perhaps with the luxury of a bit more time to see and get alongside children and families, psychiatrists do. Paediatricians seeing a child for the first time will have 20 minutes, maybe half an hour, whereas our initial assessments are often an hour or longer. And often you are thinking about, why is this person coming to see me now? What predisposed them to develop the difficulties they're having? What precipitated it? What's maintaining it? And also, more importantly, what are the strengths? What are protective factors? And that would go across the mental and the physical health. Obviously, as psychiatrists, you and I, Paul, would be mostly focused on the mental health problems, but in the back of your mind, you want to know about the physical health of the child. And there is a big overlap. If you have anxiety or depression symptoms include physical symptoms, and there are children who are often taken to the doctor or seen by pediatricians who have belly aches, headaches, fits, faints, urinary symptoms, vomiting sometimes, which is all linked to very severe anxiety or depression, with the other symptoms perhaps not evident. And equally, if you have a long-term health condition, say you have diabetes or you have epilepsy, that is a risk factor for your mental health, partly because of the rotten luck of having a mental health condition, but also because of sometimes the treatments that you're taking for your physical health condition, the impact of the treatments. If you, say, have cancer as a child, you have to have some pretty unpleasant treatment, that you have to have needles, you have to have drugs that may make you feel very ill. All of that is a risk to your mental health. And there is a lot of work that can be done on, I'm talking about two sides, because our health system, the way we train our professionals, the way we provide care is utterly separated in terms of physical and mental health. And it really shouldn't be, because there's usually a physical component to most mental health problems. And likewise, there's nearly always a mental health component to what would be perceived as physical health problems.
Thank you. So, as you said, our services are set up to be so split, which doesn't make sense. But we're building this new children's hospital in Cambridge. So will that make a difference, do you think?
I think it'll make a huge difference. And we're getting to a really exciting stage where we've actually got a whole load of projects called front runner projects, because this is really complicated. We've got two hospital organisations, the Acute Trust, Cambridge University Hospitals, and you've got the Mental Health Trust or Community Trust, Cambridge Partnership Foundation Trust. They're coming together with the research in between. So there's a university partner. So you've got a partnership of three organisations who actually are starting in a brand new place with a clean slate to do things in a different way. Now, it's not going to be, okay, we move into the hospital and we just start and it all works. There's a lot of thought needed about how we do this properly. And, for the moment, for example, if we take children with eating disorders who are severely affected enough to be in hospital for their eating disorder, at the moment, if their weight drops too far or their blood tests are worrying, they have to be put in an ambulance and taken 3 miles down the road to Addenbrooke's for their physical health care needs to be sorted out. Now, that's obviously madness, because at the time they're most severely ill, they're being taken away from the psychological treatment. If we have both in the same place, I would hope that people's admissions to hospital would be shorter. And that's what we want. We want care for the whole child as close to home, with, if you do have to come into hospital, it's for the shortest possible time so that you can be at home and be at school.
And so you've talked about holistic care for the whole child, which obviously I agree with, but very interesting questions come in, which is, as well as treating the child holistically, will the family be treated holistically? Because the stress of the primary caregivers can often be a huge influence on the mental well-being or not of the child.
Absolutely. And we have a very active, both young persons group, but also parents and carers group, who are ensuring that we get the environment of the hospital right. So the universal rooms, which won't be designated as a mental health or a paediatric bed, they can go either way depending on the needs of the young person, but there will be room within that for a parent to stay with their young person if they want and need to. There will be facilities for families to have quiet and private conversations, which often are difficult in the current situation where it's a curtain around the bed, which really isn't very private. And some thought is being given to a recovery college, which is a concept that's not new to people who work in mental health, but it hasn't been applied to physical health and hasn't been applied to children and young people, about the support that you can give siblings, parents, family about what's happening to their child, what to expect, how to support, because that is going to differ depending on the stage of the child through their journey of care, and what you need when you've got the shock of the initial admission or diagnosis will be very different from when you're dealing with sort of rehabilitation or leaving hospital after a long stay and reintegrating into school. So yes, there's a lot of work, and it's not just the child. We want to treat the family because we know families are terribly important to the welfare of children.
Thank you. And while this all sounds very good, no other hospital does this in the UK. Do you think there's going to be any barriers in trying to do this? Because it's a very different way of working for paediatricians and child psychiatrists.
Absolutely. And nurses and physios and all the staff
everyone
in the hospital, administrative staff as well. So yes, that's why we're working very hard now when, the hospital has had enabling works done. We've got a contractor appointed. So work is starting, but the hospital's not going to be open tomorrow or in a few months' time. But we think we need to start now with these front-runner projects where it'll give us experience of managing those trials where there's interest and willingness and some experience already, so that we can learn and extend out, because it's going to be a huge challenge. I mean, one of the big challenges in this area is language. We all use the same words but mean different things. And it's going to take a while to make sure that we're actually communicating with each other and saying and understanding each other. So yes, lots of challenges in terms of training, in terms of confidence, in terms of fitting in with the practicalities of what needs to be done. But it's a challenge that a lot of us are really willing to embrace and work on.
Great. Often when hospitals are built, they're designed for the majority or the vast majority, but one group that can often feel left out and feel that these places just don't work for them are neurodivergent children. And how are they being thought about in the Children's Hospital? Again, this is another really good question that's come in.
So they are being thought about. There are certainly voices with that lived experience, both parents and young people in our advisory groups. And so, for example, in the Embedded Research Institute, there is going to be a quiet waiting space for neurodivergent children to come into if they're coming in to do tests or experiments. And I know there are similar plans in the wards. And I think, one of the things our advisory group said is we want to have school as normal as we can when we're well. And so we fought very hard to protect school space, a classroom, but equally there are going to be some small rooms for the children who would find that more challenging.
Oh, it's great to hear that's being thought about properly. Now, one of the things that has changed a lot is digital technology has improved enormously in the last 5 years, let alone the last 20. So how can this be helpful? How can we use digital technologies to help us to identify, to prevent, to treat mental illness in young people?
Well, this is a really active space. I think, as with things that are often the shiny new toy, there are quality issues. There are a huge number of apps out there already. Very few have actually been evaluated. And in fact, the data shows that the vast majority, even when people pay to access them, they don't even download them, let alone use them. But I'm aware of several bits of work at Cambridge in this space. So Peter Jones, who's a professor of psychiatry, and Jan Stokel, who's what's called a psychometrician. He's very knowledgeable about scales. They've developed what's called a computer adaptive testing algorithm, which we've taken down the age span. So this uses the response of a whole group of young people who we didn't make fill in all 200 items in the item bank, but we got them to do overlapping blocks. So actually you start with something innocuous about, I feel confident, and then you have to say how much you agree. So you start with a fairly standard question, and then the algorithm will select depending on what the answer is. So it's a bit like when you buy something online and you get a message saying, well, if you like this, you might like that. Yeah. Or when you finish reading a book, it's a personalized asking of questions. And actually, we have shown when we validated it against a standardized diagnostic measure that it works pretty well as a kind of mental health thermometer, a quick test that schools could use to check out how the children are feeling across the school, or even to evaluate changes in policy. But also, if you had a child that you were aware of, they were on a waiting list either for the school counsellor or for CAMS, you could be checking in sort of every week to see how this child is doing and saying, actually, I think their case is more urgent now. It only takes 5 minutes on average.
Wow.
It asks more questions if it needs to, but on average is asking about 4 to 8 questions and then deciding, you know, where the child is in the distribution of scores. So that's a really exciting piece of work. Another piece of work that I'm involved in is, sadly, in child mental health services, we have horribly long waiting lists. So we're taking an existing therapeutic manual that I'm sure you'll be very aware of, Paul, because I know you were involved in the original trial. So we're taking the brief psychosocial intervention, which is a nice recommended talking therapy for depression. And we're basically TikToking it. We're with young people and parents and clinicians. We've co-created an online digital bite-sized bits of this manual, which is really exciting, because instead of plodding through the manual with a therapist, young people are going to be able to find their own way, so they can use it how they want. And in the autumn, we'll be gearing up for a feasibility trial with children on the waiting list in 2 participating NHS trusts. So these are children who've been assessed, they're waiting. We're very clear this is not instead of their treatment, it's whilst they're waiting. And they will be able to access this therapy. And there are various other bits of work. So there's a colleague, Anna Moore, who's managed to federate data from social care records, from GP practices, from secondary healthcare, both paediatrics and CAMS. And the idea is to search for patterns in the data as a clinical tool that would really home in on children who are struggling before anybody's worried about them, in order to try and get in and do some prevention. So that's another piece of work to work out.
It sounds like there's lots of ways that it can be used. I'm interested in the kind of online version of the brief psychosocial intervention. And obviously, I think it's a great therapy because I helped develop it. But online, you can teach people some skills. But one of the best things about any therapy is actually the relationship you have with a human being, someone who'll listen to you and care about you. If that's missing from an online app, how do you think it could work?
That's the $1 million question. So we're very clear that this is not a replacement for therapy. And I think there is a small literature about digital interventions, and people really want that individual contact. And when they're offered, instead of face-to-face therapy, an app, they feel fobbed off. So we're very, very clear that what we're testing is waiting as usual with access to this app as a stopgap, and also with the backup of the fact that there is a duty clinician that you can call during working hours and emergency lines. So this is a stopgap to help people bridge the waits that aren't going to go away. This is not an alternative to therapy. And yes, I don't know if it'll be effective. Our outcome is how the children and young people are feeling. Obviously, we will look to see whether some of them choose to come off the waiting list, but that is their choice. It's not the aim of the therapy. Actually, it may help young people. We've deliberately gone with trusts where they are offering this treatment as a face-to-face treatment. And one of our theories is it might actually help people use that treatment more successfully, because they're kind of a little bit familiar and they've had a bit of a practice. So it actually might make the therapy work faster when they get to that individual therapy.
And that would be great. Although it's a real shame of having these conversations, because this is a treatment that's being thought about because there's massive waiting lists. But yes, that's beyond our control. We've talked about some of the positives of digital technology and how we can use it, but there's also lots of concern about how digital technology might be causing problems for young people. There's a lot of stories in the media about how social media is the worst thing that's ever happened to the planet. Also lots of stories about how it does some good. So what do you think about all the publicity about the harms caused from social media to teenagers?
Are you asking me or Amy?
Amy, this is Amy.
Yeah. Great. I think, what do I think about the publicity? I think the health of our young people is critical. About 50% of mental health conditions have their first symptom before the age of 18, and it's such a critical time, both childhood and adolescence, that will set the foundation, not just about somebody's health or mental health, but also our societal, democratic health, our financial, economic health. And so I think we should be really careful and concerned about how we bring up our young people, what environment that they're exposed to. I think in the last 20 years, we've seen just massive scales of and rates of change. So it's took about, I think, it's about 100 years, off the top of my head, from the first car to be released in the UK for the 10 millionth to be sold, or 20 millionth to be sold. And TikTok got to that in, I think, less than a year. So we are experiencing a rate of change in our society that we've never seen. And we're struggling to make sense of what that means. And so I think that concerns are warranted around children, and we want to do what's best for them. And I think everybody, and I think it pushes academic research and the creation of knowledge to its absolute limits. So yeah, when I talk to politicians or the press, sometimes I get asked about the car, because with the car, that was a new technology, and we've developed safety systems, seat belts, we've developed educational classes in schools, we've developed MOTs and traffic lights and sidewalks. And all of that is to keep us as a society safe. We've not decreased the amount of casualties or injuries to zero, but we've created a sort of balance of how that technology impacts us. So people say, well, we need the seat belts, but for social media, we need the MOTs and the traffic lights. But if we think about that rate of change, we need to create that science, that evidence, those recommendations at about, multiple orders of magnitude quicker. And I think that is pushing us, as well as our policy colleagues and teachers and parents, to the very limits of our abilities.
And you see stuff on television, there's books out such as Jonathan Haidt's Anxious Generation that say this is all down to social media. I mean, Adolescence has been a massive TV hit, and their social media has been blamed on violence. Do you think it really is as harmful as some people are saying?
I think that's the big question. So we've seen in the last 20 years a very rapid uptick in mental health conditions in young people. Some of that is Tamsin's work, and we've looked at her data as well, and her colleagues' data. So I think in the UK, some of the data sets Tamsin's worked on has been leading in showing some of these trends that are exceptionally concerning. Linking it, I think, again, let's step back to what Tamsin said at the beginning. Mental health is a really complex thing. It will have huge amounts of different determinants. It will be a complex system. It won't be sort of a linear adding up of all these different factors. And so things like your family relationships, the government that is, making decisions for you, your schools, what you spend your time on, what you're not spending your time on, what you're exposed to, these will all matter. The digital world isn't just social media and certain instances of a harmful content. It transacts almost all of those determinants of health and mental health, and it will be impacting them in very unique and different ways. So I think it will have a role to play in mental health trends, but it's been exceptionally difficult to understand how much it's been behind those trends and to develop that evidence to get to being able to pinpoint exactly what its impact is, who it's impacting and the extent. And I think that's been where the sort of grounded academic research has, I think a lot of the media conversation has gotten ahead of where we are. And partially that's important, right? We need to make changes. We cannot just always wait for the science. And I've been discussing that a lot in some of my academic work. Like, how do we create evidence in a system that moves so fast? But I think there's also this, when I do a lot of, my team is the biggest in the UK studying social media and adolescents. And I think, social media will have a part to play, but if we would remove all of technology out of kids' lives now, we wouldn't know what would happen. And I also personally believe that we would still be seeing some concerning trends. So it's not a silver bullet either in either direction.
Yeah. And we've seen so many other things change and get worse in the last 15 years, whether it's COVID, austerity, a worsening of the climate crisis. It's hard to say that it must just be social media's fault. I guess one way to look at it is to compare young people who use social media lots against young people who don't use much social media at all, and to see if there's a difference in the mental health of those two groups. Has that been looked at?
Yes, so my team is doing a huge amount of work in this space. We did a lot of, we need to also look about how these things change over time. So if we just compare kids using a lot versus little social media, we do find a negative relationship. So those who use social media a lot normally report feeling worse. But that could be because there might be other drivers of that. It might be that them feeling worse leads them to use more social media. It could also be that, for example, kids in households where parents have to work multiple jobs end up using more technology and also feeling worse, and there's actually no relationship between the two. So longitudinal work, which means work where we follow young people over time, really matters. And I think one of the big things we published here at Cambridge was we looked at the relationship between social media use in 1 year and how it impacted young people's well-being 1 year later. And we did that over 7 years, over 15,000 young people. And we found that so there were times in adolescence where social media use did predict a decrease in life satisfaction, but they were different at different ages and for boys and girls. So for girls, it was in early adolescence, so at about age 12 to 13, where social media use started predicting a decrease in life satisfaction. And then again at age 19, the rest of the ages, we didn't find a link. And for boys, it was slightly later in adolescence, so 14 and 15, and again at age 19. And so this is really interesting as a developmental psychologist as well, because we do know that girls go through puberty slightly earlier than boys. So it could be that the development of the brain and our social lives really impacts how sensitive we are to social media. It could be the changes in your social circumstance at age 19, where you've just potentially moved from school into work or further education. And actually that work was used, it was cited by the Australian government as a reason to ban social media under 16, because they said that first window of sensitivity to social media is below 16. And so by banning it, we would sort of remove that exposure. So that's been a really impactful piece of work. But we're now more and more also looking at content. So we're tracking what young people see on TikTok and seeing how they feel. And for example, extracting how skinny the bodies are that they're exposed to and how they're feeling about their bodies. And we do a lot of work kind of in collaboration with regulators like Ofcom to feed that into active policy making. But I think critically as well, we need to do experiments. We need to look at what if you remove social media, what happens? And that's where actually we've currently have very little work. So while there's been some work in adults and students, often undergrads, in removing social media and seeing whether they fare better, and there's been some, I would say there's mixed results, but it does look like there's some positive impacts in removing social media. There's been no work done on healthy adolescents. So there's just one study on clinical populations of adolescents. And so we're really keen to rectify that now.
Maybe the Australian government have done that for you.
Sorry?
Maybe the Australian government are doing that experiment for you. Is
They
somebody
are.
what happens to childhood mental health there?
Yeah, I'm actually on the advisory panel to look at to evaluate the ban and to see what happens. So it's really critical for us to understand what happens, not just the impact on mental health, but the feasibility of the ban itself. They're still trying to figure out how that ban will work.
Yeah.
And we do know, young people have agency. We have seen in the US when TikTok was kind of getting ready to be banned, a proliferation of third-party, almost more dangerous apps that people were downloading. And so we're following Australia, like other governments and researchers around the world, extremely keenly. And hopefully we'll have better evidence, at least in that context, at this time next year. And I think that will inform a lot of decision-making across the board. We also see the Danish government did funded an extremely interesting trial that a colleague of mine was involved in adding friction to social media. So not banning it, but making people pause before they enter social media. And they found that that really reduced young people's use. So there are multiple different options that different governments are exploring. And we as researchers are almost always involved at the very front line of trying to, we do discovery, curiosity-driven science, but the core thing we also do in my team is, we do government consulting contracts and we work directly with stakeholders to get them the evidence they need, or we try to get them the evidence they need in time.
Yeah. And again, I don't have a strong view on whether the Australian government are doing the right thing in banning it, but I think it's great they're actually evaluating it, because that's really, really rare that governments actually bother looking at evidence, let alone creating evidence.
Yes, I think I think because there's not been a single trial in healthy young people to see what happens after you remove social media, even in the short term, it's too difficult for me to call either way. I think some will benefit, some might not benefit. We need to think about as well minority communities. So the Australian researchers really care about Aboriginal and Torres Strait Islander communities, those that are in very rural, isolated settings, and how the ban impacts them. And I think often when I talk again to policymakers or politicians, we think that the removal of screen time, like what will replace that, is often shaped by our own experience. So we might say, well, that's playing in the garden or help, practicing piano or doing more schoolwork. But we know that some children don't have access to these sorts of things. And even in a trial in London, we found that often in younger children, you can't really replace that with like reading books to them because they might not be available. So I think as a society, we need to do a lot more to encourage play, to encourage independence, to encourage young people to have all these things that are healthy. And if we remove something from their lives, we need to figure out what we replace that with. And that will not be an automatic process, or at least if we leave it to be an automatic process, there'll be a differential impact on different populations of young people. And I think Tamsin will probably know as an epidemiologist, we do see a lot of health inequalities in policies, and that's really critical for us to understand, so that it's not just the privileged kids that benefit the most.
Yeah, good point. Tamsin, do you want to add anything to that?
Yeah, I think, I don't envy policymakers because, as Amy said, it's moving so incredibly fast. I do think we shouldn't just blame social media for the deterioration that we have seen. Our young people's mental health was poor before the pandemic. I think COVID has amplified it. I think we've got a lot of learning to really tease that apart at an individual level. But at a group level, if we're thinking about the population rather than individual children, there are a lot of very well-known risk factors for poor mental health, such as the cost of living crisis, housing insecurity, food insecurity, job insecurity, all of which we know impact children and families tremendously, that are also running very high and have also deteriorated during the last decade. So I think there are lots of alternative explanations, and it's not going to be a simple one answer fits what's going on.
It will probably be an and it will be a complex system of interaction. So social media is also changing how young people talk about mental health. It's changing our awareness. It's changing how we conceptualize it. And so I think maybe we will never disentangle it completely. I think what we need to do is we also need to think in a more agile way. We need to test things quicker. And I think we as academics need to innovate how we do things. And I think that's what Cambridge has always been exceptionally good at is thinking, now we have this challenge of having to make evidence really quickly. Like, how do we do that? And for me, it's often trying to almost seek inspiration from the companies. They iteratively test things very quickly. They do A/B testing. And so my team, we're increasingly trying to move towards somewhere where you say, well, how do we create this policy parenting ready level evidence as quick as we can, while also still doing the very slow, considered, curiosity-driven science as well. I think that's the challenge.
And you make a very good point about how you need to replace social media with something else. I think social media and smartphones have made parenting a lot easier. Now, in some ways, that's been good because being a parent's more stressful because we work longer hours and have less money than we seem to used to. But parents have got used to that. And actually, if the kids can't go on their phones anymore, what else are they going to do? And a lot of parents haven't built up the skills in the same way as parents may have done 30 years ago in doing other things with the kids. And a phone's a lot cheaper than piano lessons or sports clubs.
I think as a society, we've also changed in how we interact with our kids. So I think that needs to be really thought through. And actually, I also interview for admissions, and we now increasingly see young people who've taught themselves entire courses online, who are exceptionally bright, who didn't have access to certain resources, and they now find MOOCs all over the place. And so I think we need to recognize also for mental health that a lot of young people get a lot of support for their health online, while also they'll be exposed to a lot of risks. And I think there also the role of academics is slightly different to the role of policymakers. So in other types of products, like with toys, you might have 4 kids choke on a toy, and that's enough to recall it, or to at least really fundamentally change product design. That hasn't happened for technology. So I'm not condoning tech companies. There's a lot of harms that have happened to individuals. There's content that shouldn't be online. There are designs that I find concerning. But the problem is there is that complexity around it as an ecosystem, as a way to connect. So I often say, we know what a good childhood looks like pretty well over generations, and that is stable caregiver bonds, that is varied activities, good diet, good sleep, and technology could impact those in different ways. So it might mean removing the iPad when the grandparents come around on the weekend because they live in the neighboring town, but that might actually be giving the child an iPad to FaceTime their grandparents because they live across the world. And so there isn't a biological component of screen time that will change that child's brain and will impact their mental health directly. It's what they do, and it's how it integrates into their lives. And that complexity is really difficult to get across. It's very difficult to create good recommendations. So Dame Sally Davis, who's now the Master of Trinity, she was the Chief Medical Officer when we last did the review on children's screen time guidelines in the UK that I was involved in. And at that point, we really struggled to create concrete guidelines because of this complexity.
I think one thing that we can probably all agree on is the importance of sleep, which you've already mentioned, Amy. And that's a simple recommendation to give to parents to ensure, perhaps by removing the phone at night, that children and young people are getting sufficient sleep, because poor sleep in itself can undermine mental health. And if lots of games are released late at night and teenagers will stay up because they want to get on it. We've all been a teenager, and that excitement of, my friends might be on it, so I've got to get on it. So conversations with teenagers about looking after themselves and making sure they get enough sleep, and really reinforcing that as parents and not being afraid to parent, but also setting an example. Another example I think is mealtime. So if you are a family that's sitting down to have a meal together, actually having a rule that the phones aren't at the table. You see in restaurants sometimes families with small children, they've all gone out to eat together and everyone's on a phone, which, unless you're all phoning, bringing somebody else into the conversation, which you might be, you kind of wonder why. So sleep and communal eating, those traditional things are very clear, I think, in how we can support parents to support their children and young people.
Absolutely.
Tamsin has more or less just given you the Royal College of Pediatrics and Child Health as guidelines around screen time, which shows what a great psychiatrist she is. And
it's simple and obvious, but actually loads of people do not do this as parents.
The final part of their guidelines, though, is as well as about control about screen time, and it being kind of added on to family life and not controlling family life. And I think something I've become very interested in is that people do feel like they don't have a lot of agency when they're online. So if we talk, especially designs like TikTok with those reels and the short videos, we know, so we've developed theoretical models from addiction, and here in Cambridge we have a huge history of building animal and theoretical models of how addiction works. And we do find that the designs of things like TikTok, where you don't need to decide what to watch next, you just need to decide what to, whether you swipe to the next video, you don't know what's coming next. It might be the funniest thing ever. It might well just be something quite boring. that really does drive repeated behaviors. And just a recent study in JAMA a couple weeks ago did find that it wasn't time spent on social media that mattered for adolescent mental health. It was this feeling of not being in control, or the feeling of using social media to escape other problems you have in your rest of your life. And so I think we need to do a lot more to understand how can we keep our own agency in a world where these designs are really used to ensnare our attention. And for us, we've been really excited by saying, well, let's go back to the biological fundamentals of addiction and compulsive use, and let's apply that to technologies. So we're actually running, like, instead of rats pressing levers in a cage to get cheese, we have people posting to get likes, but we're running the same models. So they're kind of reinforcement learning models for those nerdy.
It's scarily similar, actually. The stuff I learned about as a junior about rats pressing levers to get a reward. It's the best way to get rats to press a lever is for the reward to be unpredictable. And that sounds like TikTok.
And to make the lever press really easy. So I think we cannot let companies off the hook in this. It's also a capitalist system. So I do a lot of work with philosophy of science colleagues here at Cambridge. We have a world-leading philosophy of science department, as well as humanities scholars, because we do need to understand it as a whole. As clinicians or as medical researchers, we often just think about the individual, but this also exists in an ecosystem that is also dysfunctional. So, but I think it drives home that it's that pushing, we need to push those interdisciplinary boundaries and talk to colleagues from all different disciplines to make sense of this issue.
Totally. And again, going back to TikTok and these really short reels that people watch, a big concern is that that's really damaging young people's ability to have a sustained attention. And is there any evidence that actually makes it harder for people to concentrate if they keep watching this stuff?
Yeah, I think it's a lot more mixed than we would expect. So this sort of like a couple of years ago, we'd often talk about the study where they found that if you had a phone on your desk, that already decreased your ability to learn new things. And that's often cited in the media and in books. But actually big meta-analyses, which are collections of all the different studies on this topic, have found that those have largely null effects. So just having the presence of a technology in the room or on your body doesn't seem to impact your ability to learn or concentrate. And I examined a thesis on that topic a couple of years ago. The question about the current digital designs on TikTok, again, that shows you how quickly we need to study things to get to evidence, is that TikTok really just became popular in 2020. We now have had 5 years. There's been some initial things, but to show population level trends or declines, it's really difficult. So I don't think we have conclusive evidence. That's where talking to young people really matters. So, we don't always need to track things over time. Sometimes we also need to let young people disclose how they feel about technologies themselves, and we need to listen to their voices. And I know Tamsin's group does a lot of adolescent engagement. My team, we've developed a sort of AI-driven chatbot where young people can tell us what exactly they find most concerning about social media. We've now trained an AI to code that, and what we would love to do, we're waiting on potential funding, is to develop a tracker where we can show what exactly young people are concerned about with technology over time. So, for example, if you're a politician that I work with in government, and you want to stand up in Parliament and make the case for TikTok's designs really not being very good for kids, maybe we don't have the conclusive evidence yet, but maybe you could show that actually 20% of young people noted that they feel out of control when they're using TikTok in our tracker system. And so I think we also need to encourage a lot more of that citizen science. And that's something that really excites me.
Absolutely. Now, we've spoken about doctors and psychologists and governments, but actually the people who've got the most, and parents, the other group of people apart from parents who have a lot of influence on children are actually educators. It's schools. That's where kids spend a lot of their waking time. And actually, one of the questions that came through in advance was quite interesting, because it basically said, look, government are behind schools. Government have said, oh, you need to stop kids using phones at schools, but most schools have done already. What do you think schools can be doing to mitigate some of the harmful effects of phones and social media?
Yeah, I don't know whether it's by design or not, but government has been behind on, naturally, over 90% of secondary schools now have a phone policy in place. I think also by not having to drive it through as regulation, it helps by giving schools freedom to do what's for their children. So I know personally, I sit on the Department of Education Science Advisory Council. So we're 15 national experts on different topics, and we do advise on a range of different issues. And so I think that this has been thought about in a lot of detail. I think schools, I was up in Bradford. We work with Born in Bradford, which is a big cohort in the north of England. I was up there last month and I met a head teacher, and really working with schools and educators, you do see where the issues lie. And so a lot of them found that, especially coming out of COVID, that's where there was a real struggle with phones. So there seems to, for them, have been a step change pre and post COVID. And I think that just is a change of behavior, and something that I hadn't thought about. She was talking me through is that previously, if you were, for example, bullied at school, you would talk to your teachers or you'd help seek with your teachers. But now often children just go into the bathroom, take their phone out and call their parents. And so it creates a very complex system of who's trying to support the child and how. And I think it shows that, yes, limiting phones in schools has been shown to improve, well, it decreases social media use in schools anyways. It's been shown in some studies in Spain where they ban phones in some districts and not in others to improve some educational outcomes. There's less good evidence that will improve mental health for children as a whole. But I think that's because mental health is determined by a lot of things that are outside of the school. And so I always say school phone bans, they will be helpful for some things. They might well not be our silver bullet for other things. And again, and I think that's where we need, as academics, we need to help promote the understanding of the community and work with them. So I think sometimes we get pitted against those with lived experience or those who work with kids on the ground, but actually we need to be listening to them in a humble, intellectually humble way to understand what their concerns are, what solutions they find most impactful, to deliver those. And I think, Tamsin, and you would know that that's also how we deliver the best mental health interventions. It's not just saying, well, we lofty academics think this will work for you and your community. We need to listen to those who actually are impacted by that to deliver the best interventions possible.
Absolutely, totally agree.
And do either of you involve schools in your research?
I do quite a lot of work with schools. And in fact, that interface between mental health and education is something I've been very interested in over the past sort of 15 years or so, because my early research career, just everything led back to schools. So one of my PhD studied where do children go for help? And we weren't expecting teachers to be the kind of frontline service, much more than GPs. Although if a parent had spoken to a teacher at school or to a GP, it absolutely accelerated access to other things. But we weren't really expecting to find that. And, you know, increasingly, school is a setting where most children, although we've got increasing problems with attendance, but most children are in school. So it's a setting where you can reach a lot of children if you are wanting to improve their mental health. And I've been involved in trials around that. I think it's deeply worrying after the pandemic that we've got so many children who are persistently absent. It's a real issue, and we really need to think about what we're doing with our schools. There's a narrowing of the curriculum. Arguably, we don't need GCSEs anymore. GCSEs were brought in at a time when most people left school at 16. But actually, we subject our teenagers at the time of maximal vulnerability to mental health problems to really severe stress for some exams that actually 2 years later, when you do your A-levels or your BTEC or whatever, don't matter anymore. So I think we should be thinking very hard about our curriculum and the climate in our schools, because at the moment, many of our most vulnerable children are walking with their feet, and there is a huge personal cost to them, but societal cost for having so many children who are accessing so little schooling.
And it's very sad that when schools are supposed to be there to do good to children, the system, so I'm not blaming the schools here, I'm blaming the system causes extra stress to them. And I know it frustrates a lot of teachers that they're being expected to do all these things that they don't think are in the child's best interest.
Absolutely. And if you think about it like an epidemiologist, it's a mandated exposure. We demand legally that parents send their child to school. The least we can do is to do no harm. We should be making our schools as positive a climate as possible. But at the moment, it's not for many.
Yeah, and I guess putting it all together, schools are supposed to be there for education. Trying to ban kids from using phones and social media is quite a hard thing to do. Do you think schools could teach kids to use their phones and social media better? And do you think kids might listen to that?
I think schools do a huge amount of work already in terms of helping young people as they grow up to understand the world and to become effective agents within it. So there's long been educational programs about other risks to health, so sex, drugs, healthy lifestyles, being a citizen. And I think this is an area where, because even if you ban phones, even if you prevent children getting on social media during their adolescence, actually you need adults who can function as adults and manage, that there are still risks, and you need to be able to handle yourself online responsibly. And arguably, I think, parents obviously have a role, but arguably schools could really do a lot of good work around how to keep yourself online, how to behave responsibly, in the same way that, teaching children about problem solving, emotional regulation, social skills are all really useful skills that, there's not a GCSE in any of them. But actually, in terms of what employers want, they're probably more used to the young person, their family, and society.
Yeah, couldn't agree more. Amy, did you want to add anything to that?
I think on the one hand, we need to make sure that technologies are designed well, and that, designing better technologies isn't the responsibility of the schools or the parents. And I think often we are currently putting the pressure. If we come back to the car example, the school isn't going to build the traffic lights, the school isn't going to do the MOT tests, but the school will have traffic safety lessons. And when I cycle to work in Cambridge, I see a school, with very young kids, bringing them onto the road with their bikes and teaching them traffic safety. And so we all have responsibilities in that space, but it will have to be a joint effort. So naturally, ed tech and good educational technologies can also be transformative. So there has been a general pushback for technologies in schools, but really well-designed mental health technologies as well as educational technologies can be really transformative, especially for those young people that are struggling and might not get the attention, might not have that financial backing to get additional tutelage after school. So I think we need to find ways to harness those positives while also safeguarding and building skills, but also seeing it as an ecosystem where some things shouldn't be the schools or the parents or even the individuals, responsibility to solve or to accommodate for.
And I think that's a really good point to end on, is that, yes, social media exists, phones exist, they cause some harm to some people some of the time in some ways, but banning them is a very drastic step to take. And I think what may be a better approach is doing what we can to mitigate these effects on children and young people. But that takes lots of different bits of their lives. I think schools have a big role in education. Parents have a really important role in setting examples, but setting really important boundaries like bedtime and meals. And the companies that bear a lot of responsibility. Yes, they can make more money if they do things in certain ways, but they may do more harm. And then it's down to the policymakers. Expecting the social media giants to behave responsibly is, quite over optimistic. So actually, what policies do we put in to force them to behave better? It's a really tricky one. And as you said, this has not been going on for very long. We haven't got the same evidence as we have about cars. So it's a fast moving world. But
we're at a crossroads, right? Whether we trust technology or not, and what we do about it. Sorry, I'll let you go ahead.
Yeah, absolutely. I'm at a crossroads. I think it probably does more good than harm, but not for everybody. And we just got to be careful and think about it. So thank you very much to Professor Tamsin Ford and Dr. Amy Orben for generously sharing their knowledge and perspectives. I've learnt lots tonight, so thank you. I hope you as an audience have learnt a lot. Thank you for all the questions. I couldn't ask all of them, but I was trying to weave them into our discussion because I think some very good points made by everybody, because we're all coming from different perspectives here. And as a psychiatrist, I will think of things certain ways. It's going to be different to people who are teachers or pediatricians or lawyers or whatever you are. And I think that's made it a much more interesting discussion. So we've looked at the digital age, we've looked at its impact on the tender developmental years of children and adolescents, and we've heard about the critical need to see the whole child, mind and body, inextricably linked. And we thought about some of the solutions in healthcare, in government, in education. And I hope that this does lead to things being better. And I hope that people do continue to look for evidence for this, like the Australian government might be doing, and use evidence to guide what the right things to do is. As you've both said, we are academics. That's not the same as policymakers, but we've got to create the evidence. We've got to ask the right questions that matter. We've got to design the best studies that will answer those questions. but then do the right things about talking about it and letting people know what we've done and trying to persuade people to listen to us. Not always easy, but I think at this university, we've got a good record of doing good research and letting people hear about it. So thank you, everybody. Thank you very much to Tamsin and Amy for sharing so much of your knowledge. Thank you to John and Elsie for organising this, and thank you to you all as an audience for contributing very much. Cambridge Conversations returns in October. More details will follow. In the meantime, I need to let you know about the Alumni Festival that kicks off Friday the 26th to Sunday the 28th of September. There'll be lots of events online and here in Cambridge, and I hope you find out about these and find some more things that interest you. It will all be on the alumni website. So thank you, everyone. Goodbye.